In this section, I'm going to talk about the telehealth and remote monitoring and how technology can help us there. So, telehealth is remote monitoring allows us to provide high quality care from the comfort of their own homes, getting this care and not having to travel to be able to enjoy quality care. So the benefits of this is that it increases the accessibility of individual to specialized care and experts and specialists without the necessity to move there in a physical environment. Here, what the technology allows is for both synchronous and asynchronous access to healthcare facilities and providers, especially those who live in remote areas. It also allows for improved care in those with chronic illnesses who needs careful monitoring of symptoms and medication. And so these systems help these individuals to enjoy being in their independent communities without having to move, make it convenient and hassle-free to receive care while still being within their community. The all these what it means to the individual is enhanced independence, and this is one of the themes that have come out to research that most elderly people prefer their independence than be dependent on others, and this technology allows for that. What are the challenges and barriers to the adoption of uh, this telehealth and innovative technologies is basically the literacy, digital literacy. So here is where I think lots of government, like in Singapore, has been on a campaign to educate and train the elderly on how to use technology for their own personal benefit. And this can easily be done through volunteer groups and through NGO. And the other aspects of the reimbursement concerns, and this is where I think finances of healthcare needs to consider how to provide affordable and accessible telehealth services, as in the end it may impact final expenditure as by the preventative measures telehealth provides can prevent admission to hospital and expensive healthcare. The other areas that provide challenges is privacy and security risks, and this is always a possibility with the use of digital health where data breach can occur. But however, with the current adoption of various techniques like two-factor authentication, biometrics, these have been constrained by this technology to prevent any breaches. The other is the access to broadband. Most of these require broadband internet access, but as 4G and 5G gets rolled out, these are becoming less and less a barrier, and the cost of the smart devices do get cheaper and cheaper with time. And here's where sometimes subsidies can be given to help reduce the impact of aging on the elderly with the use of these telehealth platforms. So remote patient monitoring is another useful theme that has emerged from the literature on how technology can help the elderly. The importance of vital signs monitoring from pulse rate to ECGs and the respiratory rate can be monitored with the current modern devices. Even blood sugar monitoring is now possible with these devices, and also the use of medication reminders and adherence to medication can also be tracked. The other area it can help of is will be activity tracking, and this is also possible to see how the patient is moving and engagement with other individuals, and can even detect early depressions. Uh, Obviously, the important aspects is this can trigger off a telehealth consultation and makes it easily accessible to reach expert specialist care without having to travel to that area. In the area of chronic disease management, this remote monitoring can help with chronic disease management in terms of monitoring of vital signs, symptoms, and even certain parameters. It can also deliver personalized care plans, and it can engage patients and provide early intervention if need be. In terms of enhancing patient-provider communication, these devices, telehealth and wearable devices, are able to provide video consultations, secure messaging for synchronous and asynchronous communication, and also, as mentioned, remote monitoring of the patient's well-being. One of the important aspects of ensuring that these are safe and secure is to ensure that there is data privacy and security. So this must have a sufficient encryption and access control so that only the right person sees the right amount of data as controlled by the individual. And there must be compliance to regulation. So there must be regulatory frameworks within each domain to ensure safe and secure use of data. The policies must be transparent, and this must continuously monitored, and any breach must be attended to immediately and firmly. The future of telehealth for elderly care is going to be phenomenal as technology improves. There could be advancements in AI and machine learning that could help with diagnosis, to be able to look at various markers and predict disease or well states. And the integration of smart home technology can also help with the monitoring of well-being and activities, including the physical, the movement, and also any falls can be triggered of alarms. And this can help also reduce costs by making sure that premiums come down for those who use this telehealth medicine, because they would be incorporating preventative and promotive health within their life, and this should reduce high ticket admissions to the hospital. And the use of open access and open database systems would improve interoperability between various systems and would help healthcare professionals and institutions to collect and use this data for the health of the individual, and thereby make it a more personalized healthcare delivery.